Hi, and thank you for watching Nursing School Explained. This is the third video in the nursing process series where after we've gathered our assessment data and come up with our patient problems and priority list, we move into the planning phase. So phase 3 is the planning phase. And we're going to collaborate with the patient and their family to come up with some patient goals that are sometimes also called expected outcomes. And certainly this whole nursing process, and specifically the planning phase, will require critical thinking. Now, when we come up with patient goals, we follow this acronym here called the SMART criteria, which stands for specific, measurable, attainable, relevant, and time-based. So every patient goal needs to have these 5 criteria. Now, in the previous prioritization phase, phase number 2, we had identified in our patient who was complaining of shortness of breath and diagnosed with congestive heart failure that he had 3 different problems. So problem number 1 was oxygenation, number 2 electrolyte imbalance, and number 3 risk for impaired skin integrity due to the pitting edema. Now when we look at the patient goals, we can formulate them as follows. So they always start with the patient will. And number 1, if we want to address the oxygenation, the patient's oxygenation was 91% and their respiratory rate was 24. So they were hyperventilating a little bit. So now our goal can be the patient will maintain an O2 sat of 95% or greater during my shift. Now looking at the SMART criteria, it is specific to the patient because they had an O2 sat of 91%. It's measurable because I can put the O2 probe on the patient and measure their oxygen saturation. It's attainable because from 91 to 95, I can certainly accomplish that during my shift. It's relevant to the patient because I had identified this as being a problem. And it's time-based, so they will maintain this during my shift. Problem number 2 was electrolyte imbalance with the low potassium. So now my goal is the patient will have a potassium level that is within normal limits by the end of my shift. Looking at the SMART criteria, it's specific to my patient because their potassium was low. It's measurable because I can look at their metabolic panel results and their potassium. It's attainable by the end of my shift. Now certainly I'm going to have to take certain measures to accomplish that, to replace their potassium. And it's relevant to the patient because I had identified this being a problem, and it's time-based by the end of my shift. So again, we meet all the SMART criteria. The third problem we have identified is the risk for impaired skin integrity. So now our goal is that the patient will show no signs and symptoms of RIDA during my shift. And RIDA is an acronym that's commonly used for skin and wound assessment and stands for redness, erythema, edema, drainage, and approximation. And again, looking at the SMART criteria here, it is specific to my patient because I had identified this as a potential problem. It's measurable because I can go through my RIDA acronym to make sure that I can measure this data. It's attainable because I will go back frequently and check on my patient during my shift. It's relevant to the patient, again, because I had identified this as being a problem, and it's time-based during my shift. So the goal statement will always start with the patient will, follow the SMART criteria, and actually be very simple. So don't overthink this. One more note here, these all pertain to the shift. So this is more regarding an acute care setting where you would work at the inpatient hospital. If you would work in a different setting, such as home health or maybe long-term care facilities, it might be a little bit longer term that you would use here. Once we have assessed our patient, come up with a problem list and prioritize it appropriately, then we have established our patient goals, and by formulating these expected outcomes using the SMART criteria, we will use into the 4th phase of the nursing process, which is the implementation phase where we come up with nursing interventions to actually achieve our goals. So continue watching this series into the 4th phase of the implementation of the nursing process. Thanks for watching.